I'm Dr. Ryan Stanton, and it's time to find out what's going around. This week we have been seeing a number of patients with vertigo. Vertigo is the sense of imbalance and that the room is spinning, similar to the feeling you get when you spin around until you get dizzy. This is something we see year-round, but it's more common now due to the environmental allergies and symptoms associated. There are two types of vertigo, central and peripheral. Today we're talking about peripheral. Peripheral vertigo is caused by dysfunction in the structures in the middle ear responsible for sensing balance and movement, known as the semicircular canals. These structures have three hollow rings that have fluid and small nerve hairs that sense the movement of the fluid when we move our head. The brain then takes that data to determine our position and movement in space. The problem is when the data from either of the semicircular canals disagrees with each other or with some of the other senses. The brain itself gets confused with what our body is doing, and the information that it spits out is dizziness as it tries to make sense and correct the data that it's receiving. In allergies, inflammation in the nasal passages and sinuses can obstruct the tubes that equalize the middle ears. This can cause pressure differences of the air or fluid that will cause the semicircular canals to malfunction and deliver poor data. The symptoms with peripheral vertigo are worse with movements, especially with the head. Treatment includes identifying the causes, treating it, and getting the proper medications. This includes management of allergies during peak seasons, looking for potential chronic causes, medications that can desensitize the canals to movements, and procedures that can help reorient the canals. If you have symptoms, see your doctor or seek evaluation. If the symptoms are severe, avoid areas where falls could be more dangerous and have someone else drive you to the doctor. You can catch me on Facebook on the StantonMD page and at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and that's what's going around.